This program was produced by and first broadcast on Radio Kidnappers, a community access media station. Thanks to New Zealand On Air for making this type of programming possible.
Good morning, this is Heiko from Acupuncture On Air. We're talking again today with Steve Olsen from Auckland. We had a chat with him last week about sports medicine acupuncture. And today we're going to be talking about another, common condition is prolapsed or herniated disc. So good morning, Steve. How are you?
Good, thanks, Heiko. Thank you for having me here today.
Yeah, got up in time and everything, or your toddler keeping you up?
Managed it, yep, which is good.
Yes, today's topic, I think it's a common problem that I think not everyone has had it, but certainly people know of other people that have had it, which is, herniated disc or prolapsed disc. And I think for the first question that I have for you is there actually a difference between herniated disc and prolapsed disc, or is it one of the same?
It's basically one and the same, but I mean there are differing degrees of it. So I mean it could be a very small bulge in the disc coming out of the disc, or it can be the whole disc essentially just disintegrates basically. Right. So it's varying degrees, and they'll obviously present quite differently depending on the degree.
And how can it actually, manifest, or what causes it to come about?
Yeah, I mean, typically the disc has a fibrous outer layer and a gel fluid-like centre, the viscosity of that can kind of vary depending on age and person's physical condition. What can cause it? Well, the disc, basically, the outer layer starts to weaken, which then that allows the fluid to bulge out, which typically can touch the nerves. So it can be caused by acute injuries, lifting something overly heavy. A very common thing, though, is typically years of bad posture or sitting posture. When a person's sitting, that's actually when there is the most pressure on the spine.
Right. So that's like 99% of the planet.
yeah, that's right. And especially sitting in lumbar flexion, that actually puts a lot of pressure, pinches the front of the disc, which pushes the fluid towards the back, which it can sometimes just come on gradually, or sometimes it can be kind of waiting to happen, and someone lifts something heavy and it's just kind of the straw that breaks the camel's back.
Yeah, because what I've found is some of the youngest, most healthiest, sports active ones doing stretching and everything, they can get it.
Yeah, very much so.
And then you can get someone who's never had a single problem in their life, never done any exercise, and then just lifting a small little thing, and then suddenly they get it. But one thing what I found interesting over the years with it is that, and I have spoken to other doctors about this, is that sometimes, the patient will manifest everything. They'll have a herniated disc or a slipped disc, and and they can confirm, that's the thing. And then they do the scan, and then they just say, look, there's just the slightest little bulge there. How can it be causing so much pain? And then they have the other extreme where sometimes, they've just done a scan of someone's back for some other reason, and then they said, geez, half your disc is hanging out, and don't you have any pain or anything? I've got nothing.
Yeah. Yeah, I've seen that a lot. I know there's studies that they found there's quite a large percentage of the population walking around with various issues, disc bulges, bursitis, lots of things that show up on MRIs, and they actually are completely symptom-free. I mean, with the disc bulge, same as you said, I've seen some and you think, you think it would be a huge bulge, and they get an MRI and it's just a mild one. Other cases, the whole spine just looks like an absolute mess on the scan, but they've got minimal pain. I mean, so it's not necessarily. I'd say probably generally a bigger bulge will cause more pain, but not necessarily. And there's also sometimes as well when a patient can present with symptoms that look like a disc very much, but if someone's doing an orthopedic test, it actually won't be testing positive for a disc. I mean, I've seen quite a few cases where people have ongoing pain that's been misdiagnosed as a disc, get things like steroid injections into the spine, and then it still doesn't help because what's happened is they've got an MRI, they've seen a bit of a disc bulge, which probably everyone over 30 would have. Right. And then that's been decided that's the cause of the pain, when in fact it was something different but presenting like a disc.
Yep. Now, I know that people usually equate, getting a herniated disc, like, from lifting something or, pushing something really hard or something like this. But like, I actually have had a number of patients over the years, and it's just come from cycling, and in particular, even like road cycling, and you sort of think, mountain biking where they're flipping through the air and landing down really hard. But no, it's just I've had them. They're on a road bike. They're going uphill, and then suddenly they think. So, have you had any of these patients, or can you tell us a bit about the mechanism behind that?
As I was saying as well, with sitting, there's a lot of pressure on the disc. Typically, if you look at how a cyclist sits, right, the back will be in lumbar flexion, which is essentially that they're kind of leaning forward with the rounded lower back posture. Yep. That's putting a lot more pressure on the disc, so that's number one. Also with the cycling, they're just generally kind of working in one plane of movement. So, for example, their hip flexors will become very tight, which can cause basically the pelvis to come forward, which can put more pressure on the lower back, and can lead to a disc issue. Yep.
Now, I know that with modern science, we have discovered dermatomes, and this obviously relates back to herniated disc, but how does this relate back to like traditional Chinese medicine and the acupuncture meridians?
Well, I mean, you look at where the dermatomes go. So, I mean, a lot of it, you say the S1 dermatome, for example, which goes kind of slightly on the back and the side of the thigh and leg. That generally equates with the bladder channel. So, say treating the problem with that dermatome, which is basically just where a problem of that nerve level will show up. You're using acupuncture points on that will generally have a very good effect.
So would you use the acupuncture points like on the side of the leg, or do you go to that sacrum level at S1?
I personally would do both. So I treat the Chinese medicine concept of treating the root or the branch. Typically, I treat both with it, but it would depend on a case by case basis. Yeah. But typically, my experience is treating the Huato Jiaji points. And the points where the nerve root problem is. I mean,
these points they're very well known to Matt Callison from the States, who founded the Acupuncture Sports Medicine Certification Program. I know he's a really big admirer of Huato. And so, can you tell us a bit about those points, because people worry, he's going to needle into the spine, he's going to hit the spinal cord.
That's right. So, I mean, there's not really there's no risk to the spinal cord with those points. I mean, even if you look at them like the manual of acupuncture, it will always give you caution that the spinal cord lies deep to these points. But I mean, the anatomy of the spine protects the spinal cord. I mean, that's one of its main purposes. Obviously, to be any risk with that, you'd really have to have, number one, they have to have something like spina bifida. There has to be a hole in the spine,
right?
And you'd have to be kneeling through a thick ligament while ignoring their screams of pain.
Yeah.
I mean, it'd be very, I mean, and really the only risk is if there is a hole in the spine.
Yeah.
So, I mean, I've never seen any issues with needling those points, and I needle them
all the time.
Pretty much every patient.
Yeah. Now, what about moxibustion and, the application of the herbal heat to the area? Are you using that at all as part of the hernia treatment?
Use that. I mean, often a lot of disc issues might manifest as like what Chinese medicine would call a cold condition, or a deficiency in the channel. I mean, it might be what Chinese medicine would call an excess condition, say at the spine, but further down the leg, for example, that would be more considered a deficiency, whereas the channel was just basically not being nourished. So I would use moxa on conditions like that a lot.
Yeah, because that's one thing what I did see in China, that one of the doctors that I worked with for herniated disc, apart from doing all the acupuncture, the distal and the local, it was like they're in every day in an hour of moxa right where they've worked out because their simple thinking was, well, you create so much heat, you melt the disc to go back into its correct place. And it certainly, as we know, it does have incredible pain relieving techniques. Yeah,
I probably wouldn't use an hour, but I guess that's probably just time constraints as well. But I mean, also, like say, melt it back into place. I mean, often it will a lot of the ones I see, would consider, it is like a cold obstruction actually at the spine.
Yeah.
So moxa can be very useful there.
Yeah. Now, I myself, I tend to not advise my patients too much stuff to do exercise when they've got an injury. I mean, everyone has different opinions, and I know that certain practitioners, have developed specific exercises for certain injuries. But what about you? What's your sort of strategy?
It depends on the stage of the injury. I mean, say someone comes in severe pain, numbness down the leg. I wouldn't do that personally. I wait till it settles down a bit because it's kind of like an angry dog. If it calms down a bit, if you kind of poke at it, it just flares up again.
Yeah, yeah.
And in the later stages, I'll prescribe some, what just kind of more to correct a lot of the postural stuff and just strengthen the core a bit. I mean, I think in the long run, probably Pilates is the best thing for a disc. Not necessarily in terms of treating it when it's flared up, but in terms of prevention, because essentially by strengthening the core, you're taking the pressure off the spine.
Yeah, very good. And one thing what I like to do is those moxa patches, because then you can give them to the patient, they can go home, they can put them on, and then sleep with the thing on all night. But listen, I think we're running a little bit short on the time, Steve. It's been great talking with you. And
thank you very much, Heiko.
I'll put your contact details down there in the comments section in the YouTube, so people can get hold of you for
thank you.
When people are in Auckland. So thanks for coming on the show again, and hopefully in the future we can get you back on again.
Yeah, sounds great, and thank you very much for having me.
Okay, and today we're just going to finish off the show with a warning song for Ken, and it's called "To Not Mess with Jill," "Don't Mess with Jill" by Burning Spear. Another song that you know, Ken, is it?
Oh, it's one of my favourite songs. What about you, Steve? Have you heard of it?
I know Burning Spear. I don't know the song specifically.
All right. See, the fact that he knows Burning Spear, he's a good bloke.
He must be young.
Not like you.
This program was produced by and first broadcast on Radio Kidnappers, a community access media station. Thanks to New Zealand On Air for making this type of programming possible.